This is Tom Knox with Care Family, and this video is directed specifically to care managers or local agencies or group that are helping facilitate care for a local senior and their caregiver. And sometimes we get the question, how am I not deemed the employer in this relationship if I'm helping a family with a system? And we have some pretty clear advice and best practices that partners use across the country. And this comes from good, clear legal advice. Now, we always advise you, if you have questions, to ask a local lawyer or professional if you want more information. But we feel like this is a really good list of best practices for you to review. And so to start, there is nothing wrong with you introducing families to caregivers. And whether that's a local network that exists, whether that's a network we help create as far as from our databases of caregivers that could be available, and let the family or the senior decide who they'd like to hire. They're the ones who do the hiring decision. It's not your choice to say you hire that person. This is the one you're hiring, and to tell the caregiver they're hired. Number two, with pay. Always in every market, there's an appropriate pay range for a private caregiver. And that's perfectly okay to work with a family and caregiver on pay ranges. At the end of the day, the family and the caregiver are going to come up with a wage that works well for them. But having an established wage range to let people know, again, is totally appropriate. You as a care manager or a local partner can certainly help as well in going to visit the case, seeing how care is going, developing a care plan, and seeing how things are going, how the quality is in the home. Now, you're not the employer. You're not the one telling the caregiver what to do. You're not setting their schedule and saying, do this and do that. But you can certainly do that quality visit, see how the care is going, and report back to the family or the senior of your thoughts. As you know, in our portal, care managers can look in and see how things are going. They can see the attendance, when people came, when they went, certain tasks they did, caregiver notes. And that gives you great insight into how things are going. So again, you can report back to your patient or your client any thoughts on how care can be better. If you adhere and kind of follow those best practices, it's a great relationship. And remember, with Care Family, because it's so clear and the family actually becomes the employer with an EIN through the payroll, the Schedule H at the end of the year of their showing they're the employer, and the caregivers getting W-2s, it's very clear who the employer is in that relationship. So go ahead and do the right quality and care management assistance and administrative support, and it can be a great relationship for everybody.